recording. So, and indeed, Zoom has just told me he's clicked the button. Thank you, Mark. I encourage everyone, as in the previous session, do introduce yourself in the chat. That goes for everyone sort of watching today, so we sort of know who we have here, and to stimulate that discussion later on. Do post your questions as we go in the chat, and we'll pick those up at the end of the session. I'll either find those questions in the chat and perhaps invite you to say a few more words, or you can raise a digital hand when we come to that moment in the chat. Each speaker has 10 minutes, so that'll be 10 minutes from the time that they're given the floor. I will, as I'm being instructed to, rudely interrupt you with a verbal 2-minute warning at the end. So just a heads up that those will come, just to make sure we can sort of stick to time. I will try to be as unobtrusive as possible in doing so. To keep things moving, I'm essentially going to kick off straight to the next speaker after each one. So the moment that the last speaker has stopped sharing your slides, the next speaker, feel free to go ahead and get yours up and running. I'm going to keep my introductions of each of you to the barest minimum, because I'm sure you'll be able to give us whatever context you feel is relevant. And I want to give every moment of time to you so that you don't have to listen to me. I think that is all of the orders of business, other than what we'll pick up at the end. Our first presentation is actually a pre-recorded presentation, so I'm going to go ahead and share my screen, and we're going to watch this together. Just to head up that this particular video is 13 minutes long. I have been given the all clear from the authorities on high that is okay. What it does mean is it will push back the presentation times for everyone else a few minutes late, but I can assure everyone you will all be getting your 10 minutes. That we'll just have a few minutes less in the discussion. So with that, let me go ahead and share with sound, with video, our first presentation. Here we go.
So thank you very much for inviting me to talk today. I'm really sorry that I'm not able to be there in person, but hopefully this presentation will at least give you a brief overview of our study. So just to introduce myself, I'm Billie Taylor. I'm a clinical psychologist, and I specialise in perinatal mental health and the early years. So perinatal being pregnancy and the first year after giving birth. And I want to talk today about a study that we carried out called the Mums Alone Study, which was funded by the Loneliness and Social Isolation in Mental Health Network. So the aim of this study was to explore how social isolation and also related concepts like loneliness and social support are related to depression in the perinatal period. And to do this, we carried out secondary data analysis using a mixture of qualitative interview data and quantitative data that had been collected as part of a wider study, which I was also involved with. You can see on the right the main research questions we explored. So there were 2 questions. One, what role do isolation and loneliness play in the narratives of women diagnosed with perinatal depression? And the second, what is the relationship between social support in pregnancy and postnatal depression? And is this moderated by factors like age or relationship status? So essentially, we know that the perinatal period is a time of transition. It's a time when feelings of depression are quite commonly reported by women. And it's also a time when we know that women's social networks change. So we wanted to look at the relationship between these. And in particular, we know that pregnancy and childbirth is a time when women do come into increased contact with the healthcare system. So it may be a time when there are increased opportunities to offer support. So it's helpful in a way to look at whether support that aims to help strengthen women's social networks.
So everyone, I can see there might be some technical difficulties here. I'm just going to go ahead and unshare, reshare, and then start it where we left off, just so we can make sure we can get the most out of the video here. Not quite sure why that might be happening. So let's hope they'll turn it off, turn it back on, improves things.
Might be important not to share your whole screen, but just to share the PowerPoint, just to share the video.
Yeah, I thought I was, but we will certainly try to do that again.
This time
is that any better?
May be useful in helping to prevent or reduce feelings of depression later on. So a key part of our study was that we had 3 women with relevant lived experience who helped us to analyse the data So they formed a lived experience advisory group, and they really worked with the data with us, in particular helping us to understand its implications. And this was grounded in the idea that the way that we understand data will vary depending on our own perspectives. So including people with lived experience in making sense of research data can offer really important insights that we might miss or might not capture otherwise. And at the end of this presentation, I'm going to play a clip of two members of this lived experience group sharing a few of their reflections on the study. But just to start by talking about the qualitative side of the study. So for this, we analysed in-depth interviews that had been carried out with 14 women who came from quite diverse backgrounds, but who had all been diagnosed and treated for perinatal depression. And these women had all taken part in a wider study, which was looking at their experiences of accessing services for their perinatal mental health. But what we did for this Mums Alone study was we used thematic analysis to try and look for naturally occurring accounts of social isolation and loneliness within the women's narratives. So we looked really at whether and in what ways the women connected their feelings of depression during the perinatal period to isolation or loneliness. And we also drew on something called intersectionality theory to look at how other aspects of the women's identities intersected with motherhood, and how this affected or influenced their experiences. So I just wanted to talk very briefly really through a few of the key findings on the qualitative side. So we saw that mothers often did connect their feelings of depression during the perinatal period to feeling disconnected from their previous sense of self and their identity, and also from their relationships. So they talked about feeling they'd become isolated from their previous social networks, and that they'd in a way become increasingly confined to the home by motherhood. And they also spoke about feeling that they experienced increased conflict and also a lack of support from their partners and wider families often. And some of the women talked about feeling how mothers were automatically expected to be the main caregiver, and how this could be a source of tension within relationships. And you can see in these boxes a kind of vicious cycle that we saw. So we saw a pattern where women felt that expressing these kinds of negative feelings would be seen as being incongruent with being a good mother. And this acted to silence women who felt that they were failing and that they couldn't say anything about how they were feeling. This then meant that connecting with others or integrating into new social networks became more difficult, which in turn increased women's feelings of isolation and detachment, and then increased their feelings of depression as well in a sort of vicious cycle. In terms of intersectionality, we found that women from a range of different backgrounds really all did describe experiences of loneliness and isolation in relation to their feelings of depression. But we also saw that the intersect of motherhood with other aspects of women's identity left some feeling particularly isolated and marginalized. In particular, the mothers who we spoke to, who had been spoken to, felt that being young, single, or more deprived as a mother was seen in some way as deficient. In a couple of cases, it was interesting that some of the mothers who were young and single sort of tried to turn their sense of aloneness almost into a positive aspect of their identity. So they seemed to sort of be resisting the narratives that they felt were stacked against them by describing themselves as strong and determined and proud of themselves really for sort of going it alone in motherhood. But overall, certainly the mothers who were interviewed who were young, single or deprived were particularly anxious about being judged to be bad mothers, and they also described feeling particularly isolated. And I just wanted to give an example of one of the mothers who was interviewed, who we've called Lottie here. This was a young mother whose partner left her shortly after she told him that she was pregnant. And she said that she felt that parenthood had really relatively little impact on her partner, who she said quite quickly moved on to a new relationship and lost contact, in fact, with her and their son. But for her, she felt that parenthood had a huge impact and left her feeling really alone and isolated. And she described how she had to give up her job to look after her baby, how she found parenting alone with very little support relentless, and how she feared as well that she would be stigmatized as a young single mother. So she felt that she had really moved into a newly kind of disadvantaged social status that left her feeling ashamed and directionless. And she very much connected her diagnosis of postnatal depression to these feelings. So you can see in the quote, she says, "Before I was so confident and outgoing, and it was like, hey, where's the party? And now it's just, you just feel lost in a way. You want to be on the ball, perfect mum, and sometimes you just feel so low about yourself and the situation you're in. When it's raining outside, you don't want to take your baby when you've got nowhere to go. You try looking in a baby group, or you try stepping in there, and some of the women are just, they've never been in that situation. So you go in there and you're either getting looked at or just dodgy looks." It was quite a rich description, I think, of her feelings. So then turning to the quantitative side of the study, in this part, we analysed a completely separate cohort of 525 pregnant women who had been recruited from a diverse inner London hospital. And around half of these women had been screened as being positive for depression in early pregnancy by midwives. And the women completed questionnaires in pregnancy and then again 3 months after they gave birth. And these included the Edinburgh Postnatal Depression Scale, which measures feelings of depression, and the Social Provision Scale, which asks about social support. And we used regression to look at the relationship between social support in pregnancy and postnatal depression after giving birth. And what we found was that less social support in pregnancy was associated with increased feelings of depression postnatally, even after you took into account socio-demographic factors and also whether the woman was already feeling depressed in pregnancy or not. And then we also found some evidence of a moderating effect of relationship status. So we saw a stronger relationship between social support in pregnancy and postnatal depression for women who were not living with a partner than for those who were. So again, this group of women who are single or who are parenting alone seemed to be a group of particular interest. So I think overall our findings in a way suggest that looking at ways to help strengthen women's interpersonal and social networks in the perinatal period may be really valuable when considering how to prevent or reduce feelings of depression. But I just wanted to, as I said, share some reflections from two members of our lived experience advisory group, Rachel and Antoinetta, just giving their thoughts on some of the findings and the study as a whole.
So being a part of the study and hearing 14 different women have similar experiences from all different walks of life was very, very interesting. Antoinetta, what did you think?
You know, loneliness and depression can mean different things for different people. And as you said, these are 14 completely different women. And it was very interesting to hear how, you know, for some of them, loneliness meant where their previous relationships were cut off. And for others, they had people around them, they had family, but they couldn't agree with their family, or they had different views or different thoughts. And that was very interesting to see how loneliness can mean different things for different people. And yet it all brought this feeling of depression for all of them. And yeah, for me personally, it was also the shame and the fear and the stigma of having those negative feelings and associating that with not being a good mother or being a bad mother or not good enough. Yeah, I think being part of this study just gave me a chance to express that in a meaningful way and to be heard, and for my voice to be heard, and to, you know, to say that it's okay and it's something we need to talk about.
Absolutely. And I think one of the things that we explored when we was part of the study was the intersectionality and the different cultures and different upbringings. And actually there is no, you know, somebody might assume that somebody has everything, so all the money and all the house and everything, and they're okay, and somebody who's in a different walk of life wouldn't feel depressed. Actually, it just can be anyone. And who made this good mum, bad mum? Who tells us what's being a good mum and who tells us what's being a bad mum, that to the point that we end up depressed by these roles? Who created these roles? And they look so differently in different households and different families and different cultures. And it's just so real when you look through the study at how we all have our own kind of blueprint of how we expected to be as mums. And when it didn't go like that, depression was able to kind of seep in and show itself in many different ways.
I think the other thing I liked about the study is how it brought to light that, loneliness isn't always bad. And for some people, being alone gave them a chance to actually, I'm going to do this my own way. Or as one lady was saying, it's something to be proud of because I did it alone by myself. So it's different for everybody. And I think that was the biggest highlight for me.
So yeah, that was them just giving some of their thoughts on being involved and on the findings. Just to say as well, we've now published 2 papers on our findings and also a blog. So we've put links to the blog and to the papers and the titles of the papers up here. So if you're interested in reading more, please have a read of those. I think that's everything. So thank you very much.
All right. Well, thank you to the team for that. Kate, if you'd like to already go ahead and start sharing your screen, we'll keep that ticking along. But thank you. I hope you were able to see the video there. If you do have questions, I do believe Sonia's here with us and she was involved in the project. So hopefully she'll be able to pick up questions as well when we come to the chat. But otherwise, I can see slides up and ready to go. So without any further ado, over to Kate for her presentation. Just snap out of it. Thank you, Kate.
Okay. Hi, and thank you very much for inviting me to speak today. I'm Catherine Adlington. I'm the Psychiatry Registrar and Academic Clinical Fellow in East London, and I'll be presenting on behalf of my research team a project that I undertook as part of my MSc in Mental Health Sciences research at UCL last year. The project actually leads on nicely from the research you've just heard from Billie, as it's a meta-synthesis of qualitative studies about the experience of loneliness in women with perinatal depression. So the transition to motherhood is a time of great change for women and their families, with particularly great transformation in their relationships and social networks. They often experience a mismatch between personal and societal expectations of motherhood, that it should be the happiest time of their life, and actually the reality that can often be much more difficult. Women are vulnerable to perinatal depression at this time, so 1 in 6 experience it during pregnancy and 1 in 5 post-birth. And this has impacts on quality of life, risk of self-harm and suicide, and affects mother-infant interactions. Women are also vulnerable to loneliness at this time. Survey data suggests approximately 1/3 of pregnant women and new parents report feeling lonely often or always, and over half of perinatal women reported high levels of loneliness during the pandemic, when many were forced to experience loneliness and early child rearing alone. So we know that evidence from the general population suggests loneliness and depression have a complex bidirectional relationship, and we've heard a lot about that in previous presentations this morning. Depression increases the risk of loneliness and vice versa. There's increasing evidence linking a lack of social support with perinatal depression, but less is known specifically about loneliness and perinatal depression. We do know that loneliness does come up in the accounts of women in qualitative studies. So, for example, women describe a deep sense of loneliness, feeling detached and removed from those around them, and enveloped in unbearable loneliness. But very few qualitative studies focus exclusively on loneliness in these women, and there's no existing overview of qualitative research on the topic. So the aim of our study was to undertake a qualitative meta-synthesis of research exploring loneliness in women with perinatal depression, to provide an overview of international literature and identify major overarching themes, with a primary research question of what are the experiences of loneliness for women with perinatal depression in their own words, and also thinking about what helps and what makes loneliness worse for these women. In terms of methodology, we were guided by Waddell et al.'s guidance for qualitative metasyntheses. So it's a method of systematically searching and then combining relevant qualitative studies to have an overarching thematic synthesis of all the combined primary data. And we used Peplau's definition of loneliness. So we started with a pre-planned protocol on Prospero, and we started with input from women with lived experience right from the start using a patient advisory group. We performed a systematic search across 4 electronic databases up to July last year, and using search terms across the 4 key concepts. We use strict inclusion and exclusion criteria to screen the papers, particularly that the studies needed to have a majority of participants with perinatal depression, and the majority of the paper was concerned with the subjective experience of loneliness. We extracted data only from the results section, either direct quotes or analysis, and imported them and analysed them in vivo. And then we use the CASP qualitative research checklist to quality appraise each paper. In terms of data analysis, we performed line-by-line coding for initial context sets, then used an inductive data-led approach to build a framework of descriptive themes, and then ultimately an overarching analytical synthesis. And we discussed the sort of evolving code book and the framework in regular meetings with a wider research team and the patient advisory group. And the final output was a narrative synthesis. So the first researcher performed all of those stages, and then a second researcher also assessed 10% of eligible papers from the screening to the data analysis stage, and all disagreements were discussed with the wider research team. So this Prisma diagram shows that from a total of over 9,000 publications initially identified, we ended up with 27 publications in the final synthesis. And these were published between 1992 and last year. They were all from high or upper middle income countries, and an overall sample size of over 530 women. The majority of the papers were concerned with postnatal depression and with women reporting their own depression. And only one of the papers had an explicit research aim to explore the experience of loneliness, and that was actually Billie's paper that we've just heard about. 11 papers exclusively explored the experiences of women from marginalised or disadvantaged groups. So that would be immigrants or women from ethnic minority groups, or teenage mothers, for example. So this is a diagram showing the kind of meta-synthesis in its entirety, and I'm going to speak about each section in turn. So a strong theme was related to stigma. So women repeatedly described feeling stigma and judgment due to their depression, which led them to feeling like a bad mother and alone. One woman was told to just snap out of it. You have a husband who loves you and a beautiful, healthy baby. What more do you want? As a result, many women withdrew, hid their symptoms, and isolated themselves from others. I didn't want to talk to anyone about it. I always had to pretend that I was doing just great. I thought that I wasn't normal, that I was a bad mum who felt this way. Women described a sense of disconnection from themselves and others, particularly after birth. Although I had a lot of support from a lot of people, which should have made me ecstatic, I couldn't actually connect with it. And this was a common theme, that there might have been objectively support there, but that subjectively women couldn't experience it or feel it. The disconnection could be from other mothers who they often felt uncomfortable and inauthentic around, as they were unable to be honest about their own experiences. I remember going to a postnatal group and I thought, you shouldn't be here. I just felt everyone else seemed so happy and so really pleased, so I just didn't go there again. Women described a mismatch, between the levels of support they expected and what they actually received, and that could be from the wider family or community or from their partner, particularly if it was related to a gender imbalance in caring responsibilities. In terms of what made women feel less lonely, women described support, understanding, and validation from healthcare professionals could actually create connections and make them feel heard and less alone in their situation. Peer support from other mothers who understood, particularly those from similar cultural backgrounds or with experience of perinatal depression, could help. And support from family was also important. One woman said, groups are a safe place to say, this isn't the greatest time of my life, and getting some support and people saying that you're a good mum and that your baby does feel loved, even though you're not jumping up and down for joy, and that it will get better. In terms of what made loneliness worse, a lack of professional support or minimisation of symptoms by healthcare professionals, or a lack of groups and facilities, also existing conflict or separation from partner and wider family. So for example, if there was existing domestic abuse or immigration issues. One woman said, my husband left me in pregnancy, I have nobody, my family are in India, I can't speak English, I can't read English, I don't know what to do, I need help and I don't know where to go. Given the large
2 minutes, sorry, about 2 minutes.
There was a large number of studies in disadvantaged groups, and we noticed an intersectionality in the results. So perinatal depression and loneliness seem to exacerbate the multiple disadvantage that women from marginalised communities already face. For example, the stigma and social isolation that mothers who were immigrants have already experienced was made worse both by depression and new motherhood. So just briefly in terms of discussion, many of these results reflected findings from existing theory. For example, both emotional and social loneliness came up in women's accounts. They seem to be interlinked and mutually reinforcing both loneliness and depression. And this loneliness seemed to be a mediator between mental health related stigma and perinatal depression. But there were some novel insights. So the importance of healthcare professionals and interventions actually in alleviating loneliness and creating connections. And also support groups could help, but they could also exacerbate feelings of loneliness and inauthenticity. In terms of strengths, it was a novel question with important clinical implications, with a robust methodology and good patient involvement and good attempts to address reflexivity. But the individual studies had generally quite poor attempts to address reflexivity. There was certainly a lack of research in more diverse cultural settings. There are issues with diagnostic validity, with most women self-reporting their depression. And there could be an overlap between loneliness and other related but conceptually distinct terms. So in terms of clinical implications, we hope the results would raise awareness of the experience of loneliness for women with perinatal depression, particularly given the unique social isolation of the pandemic. Messages for healthcare professionals are to ask about loneliness and women's access to support and validate experiences of both depression and loneliness and reassure women that they are good enough mothers. Commissioners need to think about funding support groups for women with perinatal depression, particularly those for disadvantaged groups that are culturally appropriate and without language barriers. And in future, we need to think about more qualitative studies that specifically ask research questions about loneliness and are conducted in low and middle income settings and in different cultural contexts, and start to think about interventions that both target loneliness, but also think about whether they impact on symptoms of depression. So overall, it was a qualitative meta-synthesis of 27 studies that provides evidence of the centrality of loneliness in women with perinatal depression. Validation and support from healthcare professionals and support groups can help women feel less lonely at this time, but we need more research to understand the interaction between perinatal depression and loneliness, and particularly in different cultural contexts, and to think about whether interventions to reduce loneliness could also improve perinatal depression symptoms. So these are my references that would be available. Thank you very much, particularly to the patient advisory group and to the research team and collaborators, and particularly to my supervisor, Professor Sonia Johnson. And yes, thank you very much, and I'll be happy to answer any questions.
Thank you so much, Catherine. Absolutely fascinating. While we give you a digital round of applause, I'll invite you to unshare your screen and for Rebecca Nowland to share hers. Perfect. That's coming through just great. So welcome, Rebecca. Over to you. I believe you're muted.
Sorry about that. Kate did it so smoothly, and then I come in and have problems with tech. I had to close it down to unmute myself. Anyway, sorry. Thank you so much for inviting me to present this work. I'm a senior research fellow at the University of Central Lancashire. This work interestingly predates the two presentations that you've just seen, which is so it kind of builds on what I'm going to tell you about the evidence base. So just to give you a bit of background about why, sorry, I'm having tech issues, why I conducted the scoping review. As Kate pointed out, around a third of parents seem to report in national surveys that they feel lonely often and always. And also when we look at the evidence-based trajectory studies or trajectory studies that look at loneliness over time in parents, it seems to be around a third of those have high and persistent levels of loneliness. To me, this seems something really important to look at, but there was no comprehensive review into how, why, and which parents experience loneliness. And there was actually very little data that had looked at loneliness per se. Most of the studies had been conducted on other things, or they were qualitative studies that, as Kate pointed out, they pick up on issues of loneliness, but not necessarily the focus of the work. So because of that, it made sense to not do a systematic review and do a scoping review. Scoping reviews are different to systematic reviews in that the aim is not to answer a specific question, but to map the existing literature and comment on its nature, characteristics, and kind of provide an overview of what is kind of out there. So the aim was to provide insight into what was already known about parental loneliness and give directions for future applied and methodological research. So we conducted searches on, I think it's 6 there, 1, 2, 3, 4, 5, 6 different databases. And we were not interested, because we didn't have a specific research question, we wanted to map literature. We included any research design that examined loneliness. So we included cross-sectional work as well as qualitative work. And it was more that there needed to be some mention of loneliness within them. And we only included peer review journals just because we were doing quite a wide scope and English only. What's probably useful from this inclusion and exclusion criteria is to highlight that we just looked at mothers and fathers with children 16 years and under and living in the family home, which meant that we excluded any non-parental caregivers like grandmothers. And we also excluded adoptive or foster parents and pregnant women. So we're only looking at the motherhood experience, which could be considered a bit of a limitation. But with such a wide scope, we needed to narrow it down slightly. What we did, which is slightly different to Kate's review, is that we looked only at loneliness. We didn't look at any other factors that are often seen to be like a proxy or very much overlapping with loneliness, like social support. I did include perceived social isolation as a search term, just because that sometimes is used to refer to loneliness. Just as an overview, you can see that we didn't have many articles actually. We only started with around 2,500 and we included 133 of those in the synthesis that we conducted. Most of the studies have been, all of the studies have been conducted from 1974 to 2020, and around a third of these were conducted in the last 5 years. In the middle there, you can see very few of these studies were conducted in the UK, only 7, and most of them were conducted in America or Canada as the kind of most of where they've been conducted. There was quite a large focus on mothers only, around sort of 70% of the papers just looked at mothers, and only a third of the papers looked at both parents. And because we were wanting to map what the studies were about, we kind of category mapped them. So we grouped studies in accordance with what the findings were telling us, rather than looking at the research design that was used. And you can see that the majority of the studies were looking at parents that were at increased risk. So it's not necessarily that the studies intended to do that, but part of what they were doing was highlighting parents that might be at increased risk. There were a few studies that looked at kind of conceptual issues, which I'll look at in a minute, and a larger group of studies which looked at health and well-being impacts of the parent being lonely. And then there were some of it interventions, only around 14, so not very many really. And none of those interventions were, they just used loneliness as a secondary outcome rather than an intervention to be focused on loneliness. So in relation to the conceptuals, the studies that we called conceptualization studies, there was only 6 of these. So drawing any conclusions about this, we must be really cautious. They fell into 2 categories really. Some of them were either longitudinal studies or cross-sectional studies, looking at differences in loneliness between people who are parents and non-parents and those that have become a parent. And there is some indication that loneliness might be heightened when we become parents, and particularly in men. But again, must be really cautious with that because we're only looking at around 3 studies here. And there does seem to be some potential differences between cultures. So the relationship between loneliness and becoming a parent was not always present in some cultures in a cross-national study. Then there was also a set of really quite interesting studies in the sense that the authors, and they were all by the same author, had developed questionnaires which had subscales, and then they compared scores on the different subscales between parents and non-parents. And it did seem that some of the causes of loneliness and some of the strategies for coping with loneliness might be different in parents than other cohorts. Quite a lot of the studies were around this increased risk. And what's quite interesting about these is a lot of them were prevalence studies and not necessarily comparison studies. So we're kind of inferring these parents are at risk by the fact that their loneliness appears to be high. And you can see there that most of these studies have been done on parents with children with complex needs or special needs or health issues. It's interesting that Billie talked about young adolescent mothers in her talk. We found quite a few studies on adolescent mothers, but they were very split to whether it was associated, being a mother that was young was associated with loneliness or not. And it seemed to be that it depended on whether they navigated friendships. So a lot of young people that became pregnant found that they lost the friendships they had, and they had to either navigate their way through that by finding new friends or changing the friendships with their existing friends. So the problem with this data really is they're mostly prevalent with few control groups. So we don't really know whether these parents have higher loneliness, and there's very little qualitative work. So we're kind of left with why, although we can hazard a guess to why some of these population might be lonely. And of course, both Kate's and Billie's work gives us more understanding of why. In relation to health and wellbeing impacts, there was some studies that looked at mental health and loneliness in parenthood, and there was quite strong evidence really to indicate that depression might be associated with loneliness, as you've already heard. And then there were some studies, these were mostly cross-sectional in contrast, that looked at stress or distress or burnout. I kind of put those as a category together as kind of distress or stress in parenthood, but these were cross-sectional. Rather than longitudinal. There's also some studies that indicate that the loneliness of the parent might be associated with the loneliness of the child. So there may be some transmission of feelings of loneliness to the offspring. But again, a few studies, so there needs to be much more research in this area. And there's quite a few studies that looked at the impacts of the parent being lonely on the child's social functioning and on their internalizing behaviours, and some evidence that these are gender specific. So the transmission of loneliness might be from mother to daughter and father to daughter, and some of the gender specific effects in the sense that social functioning might be more impacted in girls rather than boys. But this is such a small amount of literature that we would need much more work to look at more evidence for this. In relation
a little
to,
under 2 minutes.
all right, yeah, I'll try and be quick. In relation to intervention studies, there was only 14. Interestingly, none of these were conducted in the UK. So we're really not doing this work in the UK, or certainly not evidencing what we are doing really well, because there probably is a lot of work looking at interventions with parents. All of these studies were not necessarily interventions to reduce loneliness, and you can see that half of them, roughly half, reduced loneliness, and half of them didn't show any impacts on loneliness. Sorry, the noise. Again, we need to be cautious with this, or look at this very much from a mental health perspective, as a lot of these parents that were included in these studies were parents with mental health or complex needs. But it does appear that peer support seems to support reductions in loneliness, and any programs that enable parents to develop social skills or develop their own parenting and potentially feel more confident about their abilities, which kind of mimics and kind of builds on what other people have said about parents not feeling good enough and how that might be linked to loneliness and depression. Okay, so I'll skip that slide just to kind of finish a bit quicker. Obviously, you can see there's a scarcity of literature here, so we need to be really cautious about any interpretations, but it does appear that parents who face more complex issues are more likely to be affected by loneliness, and parents that may feel isolated or who have been marginalised or feel they don't have similar experiences to other parents might be a bit of a trigger for maintaining loneliness across the transition to parenthood. And there is some evidence that there may be differences in the causes and experience of loneliness in parenthood, but this really is an area that needs much more evidence, as none of the studies were really focused on loneliness. And since then, I think we only have the ones that have been spoken about today. And we perhaps need to do much more work looking at whether some of this is normative and where it becomes problematic.
Well, thank you so much. A digital round of applause from all. And in the meantime, Rebecca Wheeler, I can see your camera on there if you'd like to share your screen if you need to. Perfect. That's coming through wonderfully. Well, why don't we kick straight off over to you, Rebecca? Welcome.
Lovely, thank you very much. So yeah, I'm Becca. I'm a Senior Research Fellow at the Centre for Rural Policy Research at the University of Exeter. And I'm talking about some work from a Project Plus project that I did with Matt Lobley from CRPR. He's also in the room and hopefully we'll be able to answer any questions on the chat. And we did this research with Alex Villamore and Jude McCann from the Farming Community Network. And Alex, I'll be passing over to Alex halfway through the presentation. We're going to be focusing a lot on kind of the things that have come out of the research and what FCN are doing in response to that. But I'll give you a very brief overview of the findings to start with. So just to briefly say, the research objectives were about exploring stories of social isolation, loneliness and poor mental health among farmers and farming families. This is a subgroup of the population who haven't been focused on particularly much in terms of loneliness, but we know that they do suffer from poor mental health. So we wanted to understand that in more depth. So we looked at understanding the role of farming specific cultures, identities and environments and experiences of loneliness, examining wider implications for the wider health of the farmer, farm family and farm business, and exploring the roles that different types of social relationships may play in that. So it was a qualitative research project, and we started with an online practitioner workshop with farm support professionals to get their views on the issue. We then held in-depth interviews, either online or over the telephone, with 22 farmers or other members of farm families and 6 farm support workers. We focused predominantly on livestock farms and we covered a range of ages, location, farm size and tenure in terms of where the participants were from. So condensing everything into 2 slides is tricky, but the experiences that people told us about were categorized into 3 types of loneliness. And we found there were a number of factors, many of which were kind of farming specific, that contributed to these experiences of loneliness. So social loneliness, for that we're talking about where people might have friends and family, but they don't necessarily feel the quality of relationship is there, or they don't have the time to make most of those relationships. So for farming, long working hours, lone working, and a lack of social opportunities related to that makes socialising very difficult. There's also been a decline in business-related face-to-face contact, not just because of COVID, but also just as a result of kind of shift to a digital transition over the years. And also many of these farms are rural, so therefore they have a certain geographical isolation as well. Emotional loneliness, so these were things that where people might have a good network, a good social network, but feel that they're lacking that kind of close confidant, that's that person that they can really confide in and share their problems with. And so farmers, that often is tied up with family pressures and tensions on family farms where people are living and working together. That can make life particularly difficult. There's lack of home or work boundaries because everything takes place on the farm and in the farmhouse. There's a lot of business stress and responsibilities. It can be quite a challenging occupation. And then there were other aspects which apply equally to other walks of life as well. So things like relationship difficulties or bereavement that people talked about as contributing to their loneliness. And then thirdly, we found a number of things that people talked about which we refer to as cultural loneliness. So this was the sense that as a subgroup of the population, farmers feel disconnected often from the wider public, wider society, and isolated as a result of that. And there's a number of factors that contribute to that. That includes contraction in the size of the farm community as farms have got fewer and larger, changes to and conflicts with the local rural community, a sense that the public don't understand farming and food production, and that there's a disconnect there. They get blamed for a lot of things, and also pressure from the government in forms of various regulations and policy demands. So all these things are contributing to these feelings of loneliness from among the participants we spoke to. So alongside that, we also found the evidence of links with mental and physical health. We found that women's experiences in farming and loneliness often differ from men's, partly because women are often juggling multiple family and work roles, both looking after the children and working off the farm often, as well as working on the farm. And that contributed to a kind of lack of time and opportunity to make the most of social relationships. Elements of farming culture can also underlie or contribute to loneliness. So that's things like a certain pride and an attitude that farmers should work hard. That's part of their identity, and that can be make it difficult. And then we also found implications for wider family and the business. Okay, so that was a real whistle-stop tour, but I'm now going to hand over to Alex from Farm Community Network to talk about what they're doing as a follow-up to this research.
Thank you very much, Becca, and I'll need you to flip through the slides for me if that's okay. I also feel that we should all be entitled to 13 minutes as the first speaker got. I think that's parity and fairness, isn't it? But we'll see how we go. Right, if you go through onto the next slide, please. So very quickly on who we are. So we're the Farm Community Network. We're one of the biggest national farm support charities operating across most of the UK. We help about 6,000 farmers a year with a wide range of agricultural issues. And there's almost always, whatever the issue is almost certainly unique to farming in the cases that we deal with. And we have over 400 volunteers across England and Wales providing support through a helpline, and also support through our local county groups of volunteers. And our volunteers are from farming backgrounds themselves, so it's very much farmer speaking to farmer, farmer supporting farmer. Next slide, please. That's just a map of kind of geographically where we're laid out, but you can see that we are very, very widespread in England and Wales. The only counties where we don't have county groups is because there's local support charities there, such as Lincolnshire Rural Support Network, Shropshire Rural Support, and other county-specific support charities. Otherwise, we are based in every county across England and Wales. Next slide, please. So what we wanted to do with our little section here.
I think suddenly.
Was that so?
So one of the key findings from the research was that we need to promote a culture change within the farming community that normalises taking time off, normalizes breaks, and reduces some of the guilt around working 24/7 without any time to yourself. That is indeed how we formed the press release. On the left there, you've got the headline of the press release that we issued. We've got significant media coverage off the back of that from the BBC, which you can see there is the top headline, Farmers Guardian, Farmers Weekly, etc. And we also developed a short film with a young farmer around work-life balance and how to find a healthy work-life balance on the farm, really trying to hammer home to the farming community that it's okay to take breaks. Next slide, please, Becca. Another recommendation from the study was that expansion of support and appreciation for farmers, and also greater recognition within government. Off the back of this research, we were approached by the EFRA committee to give evidence on rural mental health alongside Dr. Wheeler. And we also got a front page feature on the front of the Farmers Guardian, which is one of the most consumed magazines for the farming community, really trying to highlight where we can within our charity and off the back of the cases that we deal with on a day-to-day basis, some of the issues that are affecting farmers in relation to loneliness and isolation. Next slide, please, back up.
About 2 minutes.
2 minutes, right. We also do lots of reconnecting events in person with farmers, particularly older generation farmers that like to see people in person, and digital things digital initiatives for engagement might not work so well there. So that on the left-hand side there is an example of a local farm breakfast that we coordinated with members of the farming community. And we do those sorts of things across the whole country to bring farmers together to try and tackle isolation and loneliness. Might as well do the next slide, Becca. We also, so awareness raising, so we have on the right hand side there, you've got posters that are at 30 plus markets around the country. So where farmers are, we put our literature to make sure that we are meeting with farmers who are difficult to access, even on the best of times. And we've also recently had some significant media coverage in ITV, including Good Morning Britain with Charles Anion there, who's one of our mental health ambassadors for our charity. And one of our trustees was also on ITV News Central recently talking about mental health and isolation in farming. And next slide, please, Becca. Right, we also do targeted support for different groups, whether it's training that's delivered to young people in farming about mental health, training that's delivered to older people in relation to succession planning and retirement planning, or targeted support to women. We are looking at the research results and trying to identify those different groups and then trying to do targeted support for those different groups. Next slide, please, Becca. And another one was training for regulatory inspectors and farm assurance assessors. So we're working with NSF, we're working with Red Tractor, we're working with RSPCA Assured, and we are delivering training to them and having them deliver training to our volunteers, sort of vice versa, to ensure that they have the right skills to be able to engage with farmers in the work that they're doing, including spotting signs of mental ill health and being able to develop listening skills and knowing where to signpost people who are struggling. Next slide, please, Becca. There's two more. Right, so we're working with NHS across the country to develop resources that are useful to the farming community. That's a document that supports people with dementia and memory loss. We developed similar publications that we've done since the research and off the back of the findings of the research. And then final slide, Becca, I think is the next one. To target young people and to increase the education of the public about farming and what's involved, we have developed a children's storybook, and we're going into schools and delivering school assemblies to help young people understand about farming and see it as a viable option and career opportunity for them. Right, hopefully that was 2 minutes. Thank you.
Thank you so much. Digital round of applause from all, and indeed for all of our speakers. What a wonderful stream of ideas, and nicely related, even jumping the boundary from parents to farming. Wonderful. We have a few minutes. What questions, comments, discussion points do we have? Catherine, I see you've put something in the chat. Would you like to sort of speak your question, or would you prefer me to?
No, I'm happy to. So really interesting presentations, everyone, and especially the last one. It's not an area I know very much about, but I was just wondering how the call for kind of culture change amongst the farming community has been received by members of the community, just because culture is obviously one of the hardest things to change, but also just thinking about this idea of working hard, all the time. It has an impact on kind of productivity and income and livelihood, and just wondered how that kind of had gone down and was received by the community.
Yeah, so younger generation, I think, are growing up more accepting of that sort of work-life balance approach, and it's okay to take a bit of time off. I think that's because they're perhaps more digitally engaged and they're seeing that sort of thing on social media, etc. Older generation, it is very hard. There is still a mentality. Average age of a farmer in the UK is about 59, 60, and these are people that do tend to just hunker down. Farming is everything. Farming is their occupation and their livelihood and their life. There is no anything else beyond that. What we have found, though, is we're trying to tell people, look, be realistic with when we're talking about a work-life balance. We're not saying take half a day off. We're not saying take regular holidays throughout the year if it's not possible. But what we are saying is 10 minutes here and there, being able to enjoy your hobbies in a guilt-free way, getting off farm even just every now and then to do something that gets you out of the mindset of the farm being all-encompassing. So go and join a sports team that meets once a month or something like that. Just little things that you can do that are achievable, tangible things. And it has been well received largely from the feedback we've received.
What other questions or comments? Sonia, please.
Yeah, I just wanted to ask, maybe after the presentations on perinatal mental health, Rebecca and Kate, what you think in terms of doing something about parental loneliness? What do you think, if you were to prioritise, is most likely to work maybe in preventing postnatal depression or improving it?
One of the things that was interesting from the research was lots of the research was around postnatal depression, focusing on the period after birth. And actually there wasn't very much looking at kind of pregnancy and preparing for, and there's obviously, you know, once a child is born, there's, you know, it is a huge sudden transformation. And I wonder if there's something around kind of raising this issue of kind of loneliness, impact on life, impact on kind of social, your social situation prior to birth, kind of during pregnancy. There's a window there where kind of certainly things around awareness or building kind of social networks prior to the arrival of a child is would be really interesting just to explore that, because I don't think we know much about that. And then also I think around intervention is interesting, you know, particularly with the pandemic, you know, moving things to kind of online interventions, whether again you can be very isolated, you can be very, you know, it can be difficult to get out of the house to even attend groups once you have small children, certainly babies. So one of the studies I'm looking at was looking at online, kind of an online community. We know that things like Mumsnet are hugely popular, but I don't know if there's very much research looking at kind of specifically interventions that are online for kind of for new mothers and how those can help, kind of, even though you're engaging with them kind of alone at home, but they obviously create some sort of sense of community and feeling that you're not going through this alone. So something around how something, you know, things like Mumsnet could be adapted, or those online support and intervention could be adapted for people specifically with perinatal depression or mental health problems. So I think those are two areas that would be interesting.
Yeah, I'm doing some work at the moment, doing a systematic review on digital interventions for loneliness in parenthood. So I will be able to kind of add to that kind of dialogue when we've got to that point. We're just at the data extraction stage, so we should know some findings relatively soon. And we're doing a workshop with parents about kind of a co-design workshop around what would be a helpful intervention, a digital one. And I think for me, I think that there are a lot of parenting interventions out there that are targeted for people with postnatal depression. And I think it might be more about including aspects of that intervention to have something about loneliness, because certainly the interventions that showed a promise of reducing loneliness were the ones that were actually parental programs, which is quite interesting. Some of the other work that I've done highlighted, professionals were highlighting that they felt that parental expectations, which is what Catherine's saying there. Sorry, I was calling you Kate all throughout the presentation.
That's right, that's totally fine.
When we did a workshop a little while back with professionals about what might be the reasons for loneliness, and the thing that came out of that day was this expectation about parenthood and parenthood not being as you expect it to be. So there's definitely something about this transition to parenthood. So interventions, as Catherine's suggesting, in pregnancy would be really helpful. And I think that what comes out a lot in parental support programs is peer support is really effective when it is led and supported by professionals, which I think is hinted at in your work, Catherine, there, where they're talking about healthcare professionals, validation being really important. It's a sense that loneliness in parenthood might well be very linked to not feeling that you've become a very good parent, or something's disrupted that transition to parenthood. So validation from healthcare professionals. So any peer support should probably be a guided peer support or a supported by a healthcare professional, I think. Sorry, that's a long-winded answer to the question, but I think we know as much as we don't know right now.
Well, thank you all so much. I believe we're about to be automatically whisked back to the main room in a few seconds. We'll be back in 45 minutes for the next session. I think we're being encouraged to stay in the main room, stay locked into Zoom, but just mute and turn off your cameras for your lunch break. Otherwise, thank you all so much. And we'll see you all again in 45 minutes.